So I appreciate you all being here. I'd like to introduce today's moderator, a good friend of the Institute's co-chair of my exchange events, a member of our League of Leaders, one of the premier thought leaders on private exchanges and HSAs, and CEO of Consumer Driven, John Young.
Oh gosh, thank you. Please, please. Well, we're standing between you and a cocktail. We know it. But are you? I got to tell you what I've been thinking about. When I was a dad, my son would hold my hand in difficult times, walking down the stairs, for example. And other times he would run when he got into a safe place. And I would still keep an eye on him, so I knew that he wasn't going to run into traffic or anything like that. But it was a combination of this and this until he got older and more responsible. And then when I could trust that he would make the right decisions, I didn't have to really pay as much attention to him or focus on it. And today, we're going to talk about a movement in employee benefits which is moving employers across this country from this to letting be this. So this panel I'm very excited to have the honor to moderate this fine group. Nancy Vasta leads exchanges at Cigna. They're each going to introduce themselves and their roles and what they do for Cigna, or what they do for a living when it's their time. So I just want to tell you who's on the panel. It's Nancy. Next to Nancy is Jeff Bakke from the great state of Minnesota. Thank you. Do I hear another amen out there? Yes, thank you very much. Jeff Bakke works for Evolution One. He's the Chief Strategy Officer. Evolution One is a WEX company. Next to Jeff is Eugene Sayan. Now, you've got to first give a round of applause to Eugene because he gave us wireless. Eugene, thank you for the wireless. And next to Eugene is Robert Steele, heads up Quadrant 4. And I have to tell you, I'm so excited to have him on my panel because, guys, I'm going to go over to his house a couple of times a year to borrow a cup of charisma. The guy is great. And then finally, next to Robert is Dave Firestone. Now, Dave leads the exchange strategy at Aetna. So the bookends are the big carriers, and in between are technology companies. And so, let us begin.
Good afternoon. I'm Robert Steele, and I'm president of the Quadrant 4 Health Division for Quadrant 4. I'll start with a little story. After John mentioned I played football, I actually was licensed to sell insurance in 1976. I went into the business full-time in 1980, and one of my first appointments, I was having a cup of coffee getting prepared for the first meeting. One of the guys in a small town called Columbus, Georgia, home of a little company called Aflac, said to me, who was a banker, was getting ready to go to work, he said, "Robert, what's it like playing professional football and going to a diner where everybody wants to talk to you, to going into an industry like the insurance business where nobody wants to talk to you?" And that was a start of my career, of knowing and understanding that I needed to present myself a little differently than I wanted to be seen as from the entire public perception. So one of the things that I started doing was I gravitated toward technology. And so as I shared with some of these gentlemen earlier, I built a Section 125 system from scratch in 1983. That doesn't mean anything other than the fact that what I wanted to do as an individual was try and help my clients manage their insurance and benefits and financial services in a different way. And as a broker, and I must be hitting this slide by accident, sorry about that. There we go. Sorry about that. I can talk about any slide, I just want to make sure I get it in the right order. So as I talk about Quadrant 4 is a technology company, plain and simple. We have 4 verticals: healthcare, media, education, and services. And I can't seem to get this to go anywhere I want it to go.
back it up to his first one?
Sorry, guys. I may be going the wrong way. Nah, maybe we're there. There we go. So what Quadrant 4 again is a technology company. We're focused on 4 verticals. We also call ourselves a SMAC company, which is social, mobile, analytic, and cloud. And within that environment, we are building verticals, we're building platforms for those verticals. And within that, what we have tried to do with each of those verticals is build what we call an industrial strength platform. And one of the things, as Eugene mentioned, how sometimes you really learn a lot from failure. We learned a whole lot from failure because we bid on 11 state exchanges and came in second to Accenture on Cover California. What we decided to do was take all the knowledge that we had from those second place finishes, and also what we had been doing from the benefits administration space since 1999 and 2000, and also from a TPA perspective and a system that we had built for some TPAs, and also an MGA system for marketing general agencies. And we decided to build something unique. We wanted to build an exchange platform that really was more than just an exchange platform. It actually would manage benefits administration and all of the components for all the stakeholders, because that's what I became passionate about in 1999, was when I first started looking into benefits administration, was how could we design a technology platform that could truly connect all the dots and help agents and brokers do what they want to do, which is to sell more business, to retain more customers and generate more commissions. In addition to that, from a health plan perspective, how could we help them become more operational efficient, as well as their health plans are facing MLR, and I don't know how many of you have truly studied the MLR component of ACA, but MLR, is medical loss ratio. There's an 80-20 rule. The health plans have to pay all the claims out of 80 pennies and pay all their administration out of the other 20. It is one of the few laws where we're actually telling the carriers or the people that manufacture products and sell goods that they really can't make a profit. And it's hard on the insurance companies to really manage that. So they have to become more operationally efficient. In addition to that, we look at all the trading partners. We look at the other partners in the industry, like Evolution One, folks that want to participate in that ecosystem. And so that's what we chose to do, was to build that ecosystem to truly connect all the dots. We call it a hybrid exchange. For the FTEs, you can do sophisticated benefits administration. For your contractors and your COBRA and your retirees and your seasonals, you can actually have the access to the web broker entity, which we are as well, the ability to connect all the dots from the management and administration as well. So that's what we call the hybrid exchange. Separately, I mentioned the SMAC company. We do have social mobile capabilities within our platform. We also have analytic capabilities to really know and understand when a consumer gets off the track and how to pull them back. And that's also what we call the reach and teach. One of the things that the Affordable Care Act has basically created is, it's not the Affordable Care Act for brokers, it's the Annihilate Commissions Act. And you have to be better prepared today than you were yesterday to manage all of that. And it's truly going to be technology and a technology partner that knows and understands the healthcare side of the house, but also the education side and managing digital content that Quadrant 4 is truly known for. Reach and teach is a concept that is really leading edge in terms of helping brokers help their consumer clients. To help a broker, help a client, to reach them where they live and breathe, on the device they know and trust, with the information they need at the time they need it. And that might be open enrollment only, it might be change of family status, it might be a health event, life event, or other event. We want to help them help that consumer understand insurance benefits and financial services, which most don't understand to the level that they should, and teach them what they need to know when they need to know it. That's my story, and I'm sticking with it.